Hello, everyone. Let's go ahead and get started. Thank you so much for joining me today, and thank you for inviting me to speak with you. I really appreciate all of the incredible work that you're doing to keep our people safe and healthy on roads, not just in Latin America, but also beyond. And today I want to talk a little bit about how we can focus on children, one of our most vulnerable populations, and how the pandemic actually presents a unique opportunity to accelerate a lot of the work that we're doing. So first, a little bit about me. My name is Natalie Draisin. I am the North America Director for the FIA Foundation, and I have the pleasure of working with many partners across the region, from Fundación Gonzalo Rodriguez to WRI, NACTO, ITDP, and others. And the FIA Foundation is a global philanthropy that focuses on safe and sustainable mobility around the world. And it's thanks to the work of our partners and people like you that we can make progress in saving lives on the roads. Today, I want to talk a little bit about children, though, and our Child Health Initiative, which has the goal of safe and healthy journeys to school for all children. And you'll see our three key aims here. But what we want to focus on really is air pollution and road traffic injuries. And so why air pollution, right? Because we often talk about road traffic injuries, but not always air pollution. And the reason that we focus on air pollution is because we have invisible killers of our kids on the roads. You can see 93% of children breathe dirty air. And for children whose lungs are still developing, this has lifelong consequences like asthma and lung cancer. But beyond that, let's remember that road traffic injuries are the leading killer of people ages 5 to 29 around the world. And when you add these two things, you can see that there's an immense toll. Now, if you think about the other ramifications too, because we have, interconnectedness along all of the Sustainable Development Goals. Take a look below the waterline here, right? There's obesity, there's overweight, not getting enough exercise. When children can't go outside to play and exercise or walk and cycle to school, this is what happens. And there are, of course, serious injuries that we need to focus on as well. And in fact, if you think about the 2.2 million children and adolescents who are seriously injured in road traffic injuries, it's almost a third of the population of Paraguay. So it truly is an immense toll. And unfortunately, the poor who are affected by this are not only more likely to be injured and killed, but they're actually also more likely to become poorer because of these injuries, because they can't afford the health care that they need to heal, or parents have to stop working to take care of their children. Children can't go to school to get an education. So this does have generational effects that span all of the SDGs. We will never reach the SDGs until we address road traffic injuries for children. You'll see here that road traffic injuries are also really expensive. Look at this toll, $24 trillion in crash costs to the community. And this isn't just children, but this is the larger toll on all of those affected by road traffic injuries and deaths. And you can see if we don't do anything between now and 2030, look how many people will be injured, 500 million. That's a lot of people. It's more than I can certainly wrap my head around. And that's why the second decade of action to 2030 is so crucial. So you can see, though, that children and adolescents are really at enormous risk, right? Like I said, leading killer of those between ages 5 to 29. And how do we protect them? How do we protect the children that are making up our future? Well, that's where this guidance comes in. This is one of our latest efforts from the Child Health Initiative. We coupled with UNICEF to produce this guidance that I'm happy to share with you today. And the point that I want to drive home here is that there are many things that we can do that will not only reduce road traffic injuries, but also prevent the spread of COVID-19. The guidance has 10 key actions you see here, and the point of this guidance is to capture a broad illustrative set of interventions that we can apply across many different countries, focusing on many different situations, and also to be low resource, right? We don't want to have to spend a lot of money on these interventions. We can't in many situations, budgets are really tight. And the good news is that we don't have to spend a lot of money. And you'll see some of these examples in a few minutes. So before I go into the guidance, I just want to say, I would bet that many of you watching this have examples of safe and healthy journeys to school during the pandemic. And we want to hear from you. We want to learn from you. So I'd ask you to please contribute those examples to our database that you see here. It's really easy to do that. This is the website. It's childhealthinitiative.org/COVID-19. Please visit the website. Please contribute and share this with many people. So the first key area I want to go into is active non-motorized transport to support physical distancing. I'm not going to go through all of the guidance today, just the things that I think will be of particular interest. The point here is that when you create space for children to physically distance at the school, you're also letting them walk and cycle to school safely. So you're reducing the chances that they're going to get COVID-19 because we know that it's less likely to spread outdoors and if you are more than 6 feet apart from people. And we're also making sure that kids aren't interacting with cars. So check out this intervention from NACTO in Bogota, Colombia. You can see how much space that children have just with the help of a little bit of paint and planters. It looks welcoming and fun. And we closed off the street in front of the school to cars to make it safer. Now, this is just one of the many examples that you'll find in the Designing Streets for Kids guide from NACTO, and I really hope that you'll check it out. I think it's applicable to many areas in Latin America. It has lots of examples, and a lot of these examples actually are really applicable during the pandemic as well. Now, what we can do is again, close off streets. But if your school is on a busy road, maybe you can't close off the whole street, but you can just close off a lane of traffic. And that's what some schools in London are doing, for example. We're calling this the School Street Initiative in London. And this is how we measure, right? Because we do have to measure everything that we do. And I think it's really helpful to see what other cities are doing. Now, I want to talk about how to make it safe to walk and cycle and scoot and ride a wheelchair too around schools, because we can't expect kids to walk and cycle to school if it's not going to be safe. The key here is speed reduction, right? Lowering speeds to 30 kilometers an hour, which is a best practice by the World Health Organization. And I love what Vietnam did here. They lowered speeds, and for the 2 weeks after they lowered speeds, when kids went back to school, they just reminded people of the lower speed limit, and then they started enforcing fines. This was their special back to school during the pandemic speed management initiative. Just one example of how we can encourage kids to walk and cycle safely to school during the pandemic, reducing the likelihood that they will get COVID-19 and also be hit by a vehicle. This is a walking school bus. This is an image from China, and a walking school bus, as you know, is when an adult picks up children on a safe and pre-designated route to school. And here's a cycling school bus from Bogota. It's El Colegio in BC, which I'm very proud that our partner WRI has been involved in. And I love that they've adapted to the pandemic. They've helped make sure that kids who can't, cycle to school because schools aren't open right now can get out in front of where they live and exercise and play there. So just a great example of how we can adapt already ongoing programs to the pandemic. Now, of course, bicycles have to be available in the first place, and we have to have the infrastructure there to support them. So this is the India Cycles for Change Challenge. You can see some examples of what they suggest cities can do, from creating pop-up cycle lanes to designating slow zones, implementing cycle sharing systems, involving the whole community, and giving some bicycle maintenance too. I do want to emphasize here that a great thing that I've seen lots of Latin American cities do is having a car-free day, so like Ciclovia, right? where you're encouraging people to get out and use the streets. You're letting kids have space to learn how to ride a bike safely, and letting everybody get outside, because that's really what we all need right now for our mental health, is the opportunity to get outside safely and move around. Now, also, please note how important it is to involve youth. They can be very powerful advocates. And this is an example from Vision Zero for Youth in Mexico City, also being done in Bogota, by the way, and India and the US. And students here were taught basic road safety measures. And then they were asked to design what kind of street they wanted in front of their school. And you can see that on the lower right-hand corner. They designed curb bump outs and a crosswalk too, so that they could get to school safely. And it's incredible, the power of paint, right? You can see on the left-hand side, they're just painting. It's not that expensive. The whole community helped. And it's empowering when this girl looked at the camera and said, you see this crosswalk? I painted that. That was me. I helped, protect myself and my peers. This is a girl who can now see maybe a future in road safety where she couldn't before. So, the expression is nothing for us without us for youth, right? Remember to ask youth what they want and take them along in your interventions. Now, of course, we have to help students follow protocols, and that's pretty easy to do. I love what Bogota is doing, their free bike school. This has been going on for some time. This is a great time to do this. Help students learn to cycle and cycle safely. In Addis Ababa, Ethiopia, they are closing down unused parking lots so that students can learn to cycle in the parking lot. What a great use of public space right now. In India's Cycles for Change Challenge, they're having community-led bike rentals. So if your neighbor has a bicycle and maybe they're not using it, you can borrow the bicycle through a community scheme. Just one way that we don't have to spend a lot of money, but we can rely on each other to have some non-motorized transport. And of course, we have to reduce private vehicle use, right? In the US, this is a big issue. We rely far too much on our cars to drive our kids to school. I know it's an increasing issue elsewhere too, but there are things that we can do to reduce private vehicle use. And one of those things is carpooling and members of your bubble, right? So your bubble of people who are reducing their exposure, agreeing on terms to keep themselves safe, and sharing one car to get to school. I love this solution. It's a remote drop-off area. So this is a photo from New Zealand. It's called a kiss and go zone, where you drop off your kids at a parking lot or a community center or a church or a synagogue or somewhere nearby the school, and then they walk or cycle, probably walk, the rest of the way safely. So you're reducing emissions around the school. And we know that that's so important, right? Because 93% of kids are breathing toxic air, and air pollution actually increases the severity of COVID-19. So now more than ever, it's really, really important to reduce air pollution around our schools. We can treat school buses as extensions of the classroom. This is so important. They should offer the same level of equity and hygiene and safety as the rest of the classroom. Now, how do we do that? It's actually not as complicated as you might think. In South Africa, ChildSafe is providing bus drivers with what you see here. And I want to draw your attention to the attendance register on the lower right-hand corner. That is really important for contact tracing. If somebody gets sick, we can notify everybody else who might have been exposed. Not a difficult thing to do, just a clipboard with a list of names and who was on the bus when. Another thing to just draw your attention to is the idea of a bus aide. So someone who can help enforce protocols, and if you're doing health screenings before a kid gets on the bus, conduct those health screenings so that the driver can drive. And also to consider, what's the driver going to do if the student screens positive? They can't just leave the student and then drive the rest of the kids. You don't want to leave a student unattended. So a bus attendant can really help do that, a health aide. Now, to reduce exposure when we're boarding the bus, if you board from the back to the front so students don't have to pass each other and skip rows, that really helps too. And you can designate the rows by tape, as you see here. Opening windows in shared transport is really important. Shared transport and buses. And I say shared because I know that especially in other countries, not everybody is using a school bus, right? But there are things that we can do in shared transport to help keep our kids safe. Opening windows and maintaining as much distance as possible from each other. Mask wearing all the time, by the way, throughout the whole journey is also really crucial. Again, public and shared transport. So a lot of the school bus things that we just talked about apply to public and shared transport. For motorcycles, in many countries, we've got motorcycles everywhere. We can have motorcycles keeping a distance when they park, right? So you can see what they did in Vietnam, just parking lines for the motorcycles so that we can see how much of a distance they're keeping from each other. Now is a great time, by the way, to have a helmet law. Head injuries are a serious toll on the healthcare system, and we can't afford to put further strain on our healthcare system right now. So the pandemic is a really good excuse to pass that helmet law. Vietnam has had enormous success with this and saved many costs and lives. So please check out on our website, Head First. It's on our publications section on our FIA Foundation website or Child Health Initiative, and you can see how Vietnam got their helmet law so that you can help shape one for your country too. Now, interestingly, if you're on public transport and you're encouraging people to not talk, right, because talking can help spread COVID-19, unfortunately, to wear a mask, to keep a distance, and travel during daylight hours because it's safer, you're also reducing harassment. And this is so important because there's, just like you're addressing several SDGs when you're talking about reducing road traffic injuries among children, you're also addressing several threats when you're doing these interventions that help reduce road traffic injuries and reduce the spread of COVID-19. And one of those threats, like I'm saying, is harassment on public transportation. We need to ask people who face high levels of harassment, like women, like minorities, how they're feeling on public transportation and how can we help them. But enforcing these interventions is one way to do it. Now, sustaining changes in the long term. I know this is hard because some of the interventions we're talking about are temporary, right? But there are plenty of things that we can do. One of those things is shown in Addis Ababa, where they are prioritizing high-risk areas for road traffic injuries and doing a phased approach of their non-motorized transport plan. They're revamping that entire plan because of COVID-19 and really prioritizing walking and cycling. I would encourage everybody to collect data. Now is the time that we need to show that road traffic injuries are going down and air pollution is going down because of these measures that we're implementing to also stop the spread of COVID-19. Maybe this looks like installing an air monitoring device at your school to show that air pollution has gone down. Maybe this looks like gathering data around an intersection where you've closed off the streets in front of a school where children can now walk and cycle safely because there's lower speeds and less cars, and showing that there are less road traffic injuries amongst those children. Maybe it's showing that, where we're taking children to school on our buses, we haven't had any outbreaks of COVID-19 when we are being safe on our buses. Because, by the way, there have been no COVID-19 outbreaks tied to public transportation. So I do just want to say that we are kind of all afraid of public transport right now, but it does seem like it's safe to use public transport to go to school. And that's a really important part of decreasing emissions and the number of cars on the roads. So collect data. Check out childhealthinitiative.org. There's a lot of tools on here that you can use to collect data in a very low resource way, depending on the time and expertise and money that you have available to do it. Our website is geared towards low resource areas and low and middle income countries. So I'm confident that you will find something that will help you. And if you don't, I hope you'll also tell us, because we want to make sure that everybody has the tools that they need to ensure safe and healthy journeys to school for all children, not just during the pandemic, but also beyond. We have to make these temporary changes permanent. And in order to do that, we need the data to get the political will and the resources to do it. So with that, thank you so much again for letting me join you. And please check out our website, childhealthinitiative.org/COVID-19, to provide your examples of safe and healthy journeys to school during the pandemic so that we can all learn from each other. And thank you so much for what you're doing. Stay safe and be well.